Right now, somewhere in your bathroom cabinet, there is probably a small bottle. It fits in the palm of your hand. It costs just a few dollars. And millions of people over 60 use it every single day without a second thought. They reach for it in the morning. They use it before bed. Some keep one in their purse or their nightstand because the thought of being without it makes them genuinely anxious. That little bottle is a nasal spray. And what I'm about to tell you today is something that most people who use it have absolutely no idea about. That nasal spray, the one you trust completely, the one that feels like the only thing that lets you breathe, may actually be the reason your nose never gets better. In fact, it may be making your congestion permanently worse with every single use. I know that sounds impossible. I know you are probably thinking, but it works, it helps me breathe. How could something that helps me be hurting me at the same time? And that is exactly the question I want to answer for you today in a way that is completely clear, completely honest, and medically accurate. I am Dr. Weston, and in over 15 years of practice, I have seen this pattern repeat itself so many times that I felt I had a genuine responsibility to make this video. Today, we are going to talk about nasal spray addiction after 60, what it actually is, why it happens, what it does to your nose over time, and most importantly, what you can do about it. Because yes, there is a way out. And it is more manageable than most people think. Stay with me because later in this video, I am going to share a step-by-step approach that has helped many of my own patients break free from nasal spray dependence and breathe naturally again. Most people never hear this from their doctor because it simply does not come up unless you ask, but you deserve to know. First, let me explain exactly what we are talking about so there is no confusion. The type of nasal spray I am referring to today is the decongestant kind. These are the sprays that contain active ingredients like oxymetazoline or xylometazoline. You will find these ingredients in some of the most popular over-the-counter nasal sprays available in pharmacies across the United States, the United Kingdom, and Canada. They work very quickly. Within minutes of using them, your nasal passages open up and you can breathe freely. That relief feels wonderful, especially if you have been struggling with a blocked nose, and that is exactly why so many people reach for them again and again. But here is what the small print on that bottle says, and here is what most people never actually read. These sprays are intended for short-term use only, usually no more than 3 consecutive days. 3 days, that is it. And yet survey after survey suggests that a significant number of people who use these sprays have been using them daily for months, years, or even decades. I have had patients in my practice who cannot remember a time when they did not use their nasal spray every single day, and they had no idea they were caught in a medical trap. Let me explain exactly what happens inside your nose when you use one of these decongestant sprays so you truly understand why this becomes a problem. Your nasal passages are lined with tiny blood vessels. When you get congested, those blood vessels swell up, narrowing the airway and making it hard to breathe. What oxymetazoline does is cause those blood vessels to constrict, to tighten and shrink, which opens up the nasal passage and gives you that immediate relief. Simple and effective in the short term. But here's where the problem begins. Your body is an extraordinarily intelligent system. When it detects that something external is repeatedly causing those blood vessels to constrict, it begins to compensate. It essentially fights back. The blood vessels become less responsive to the medication over time, and they begin to develop a tendency to swell even more aggressively than before when the medication wears off. This is called rebound congestion. The medical term is rhinitis medicamentosa, and it is a completely real, well-documented, and medically recognized condition. What this means in practical terms is this: you use the spray, you get relief for a few hours, the medication wears off, your nasal passages swell back up, but this time they swell worse than they did before you used the spray, so you reach for the bottle again, and the cycle repeats. Each time the rebound congestion gets a little worse, each time the window of relief gets a little shorter. Before long, you are using the spray multiple times a day just to maintain basic breathing. You are not using it because you are sick anymore. You are using it because without it, your nose completely closes up. You have become dependent on it, and the spray itself has become the cause of your congestion. I had a patient, a wonderful gentleman named Gerald, 68 years old, a retired teacher. He came to see me one afternoon, and the first thing he said was, "Doctor, I have had a blocked nose for 3 years. I have tried everything. I cannot sleep without my nasal spray. I use it 4 or 5 times a day. Something must be seriously wrong with me." When I asked him which nasal spray he was using and how long he had been using it daily, he thought for a moment and said, "I think about 3 years." The timing was not a coincidence. Gerald did not have a mysterious chronic condition. Gerald had rhinitis medicamentosa. The spray he had been relying on for 3 years was the direct cause of his 3 years of blocked nose. When I explained this to him, his expression was a mixture of relief and disbelief. He could not believe that something so small and so freely available had been running his life for 3 years. Now, here is why this is especially important for people over 60 and why I want you to pay particular attention to this part. As we age, our nasal passages naturally become more sensitive. The mucous membranes thin slightly. Blood flow patterns change, and the natural mechanisms that regulate nasal airflow become less efficient than they were in younger years. This means that older adults may be more susceptible to developing rebound congestion more quickly and more severely than younger people using the same product. At the same time, many people over 60 are managing other health conditions and taking medications for blood pressure, heart health, or other concerns. Some of those medications can themselves cause nasal congestion as a side effect, which is often what drove someone to reach for a nasal spray in the first place. And some decongestant nasal sprays, if absorbed into the system, can affect blood pressure. For someone already managing cardiovascular health, this is an interaction worth being aware of and discussing with your doctor. There is also a psychological dimension to this that is very real and very understandable. When you have been using something every day for months or years, and it is the only thing that lets you breathe through your nose, the idea of stopping creates genuine anxiety. What if I cannot breathe? What if I cannot sleep? What if it gets worse before it gets better? These are completely legitimate concerns, and I want to address them honestly because pretending this is simple would not be fair to you. Breaking the cycle of nasal spray dependence is not easy, but it is absolutely possible. And the approach I am going to describe now is grounded in real medical understanding of what your nose actually needs to recover. But wait, because what I am about to share next is the part that most people never hear, and it is the most important part of this entire video. So please stay with me. The key to recovering from nasal spray dependence is understanding that your nasal passages need time to recalibrate. The blood vessels need time to regain their natural tone without the constant interference of the decongestant medication. This does not happen overnight, but with the right approach, it does happen. The first and most important step is to speak with your doctor before you make any changes. I want to be very clear about this. Do not simply stop using your nasal spray cold turkey without medical guidance, especially if you have been using it for a long time. Your doctor can help you develop a safe and gradual plan. In some cases, a doctor may recommend a short course of a steroid nasal spray, a completely different type of medication, which works by reducing inflammation in the nasal lining and can help support the recovery of the nasal passages as you reduce the decongestant. This is a conversation worth having. Please do not try to manage this entirely on your own. Here is a pro tip that many people find genuinely helpful during the transition period. Saline nasal rinses or saline sprays, simple saltwater solutions, can be enormously supportive during this process. They are not medicated. They cannot cause rebound congestion. What they do is help keep the nasal passages moist, help clear irritants, and help support the natural function of the nasal lining. Many people find that using a saline rinse regularly helps reduce their discomfort as they work toward reducing their dependence on decongestant sprays. You can find saline sprays at any pharmacy, and they are completely safe for daily long-term use. Now, let me tell you about some natural approaches that some people find helpful in supporting nasal health during and after this process. I want to be honest that these are supportive measures rather than replacements for medical guidance, but they are genuinely worth knowing about. Steam inhalation is one of the oldest and most consistently reported natural approaches for nasal congestion. Simply breathing in warm steam, from a bowl of hot water, from a warm shower, or from a steam inhaler, can temporarily help open nasal passages and thin any mucus that is contributing to congestion. Some people add a drop of eucalyptus oil to the water, and many report this enhances the effect. The warmth and moisture work together to soothe inflamed nasal tissues. For someone over 60 dealing with the discomfort of rebound congestion, this simple practice morning and evening may provide meaningful relief. Proper hydration is something I cannot emphasize enough in this context. Your nasal membranes depend on adequate hydration to function properly. When you are even mildly dehydrated, those membranes dry out, become more irritated, and more prone to swelling. Drinking enough water consistently throughout the day, not just when you feel thirsty, because as we discussed earlier, our sense of thirst becomes less reliable after 60, is one of the simplest and most important things you can do to support your nasal health. Warm fluids in particular, warm water, herbal teas and broths are especially helpful because the warmth provides additional soothing benefit to the nasal and throat passages. Bedroom air quality is another factor that is often overlooked but genuinely significant. Dry air, whether from central heating in winter or air conditioning in summer, dries out nasal membranes and worsens congestion. A bedroom humidifier that maintains humidity between 40 and 50% can make a real difference to how your nose feels overnight and in the morning. Many of my patients have reported that adding a humidifier to their bedroom reduced their overnight nasal symptoms considerably. If you are finding this video helpful, please hit the like button right now. It genuinely helps me reach more people who need this information, and it takes just 1 second. Thank you so much. Let me also tell you about something that many people do not connect to their nasal health, but which some research suggests may play a role. Diet and inflammation. Chronic low-level inflammation in the body can contribute to inflammation in the nasal passages and sinuses. Diets high in refined sugar, processed foods, and certain food additives have been associated with increased inflammatory responses in the body. On the other side of this, foods rich in natural anti-inflammatory compounds like ginger, turmeric, garlic, and dark leafy vegetables are often recommended as part of a diet that may support reduced body-wide inflammation. This does not mean that changing your diet will cure nasal congestion, but as part of an overall approach to better nasal health, it is a factor worth being aware of. Now, here is an important warning that I want to share clearly. If you have been using a decongestant nasal spray for an extended period and you notice any of the following, please speak with your doctor promptly. If you experience any nosebleeds that are occurring more frequently than before, chronic use of nasal sprays can sometimes damage the delicate blood vessels of the nasal lining. If you notice any changes in your sense of smell, this can occasionally be associated with prolonged nasal inflammation. If you have any pain or pressure in your sinuses that feels different from typical congestion, this could indicate a sinus infection or another condition that needs evaluation. And if you are managing blood pressure and you notice any changes in your readings around the time you use your nasal spray, this is worth mentioning to your doctor, given that some decongestant ingredients can have cardiovascular effects in certain people. And here is the second important pro tip I want to leave you with. There is a very simple test you can do at home right now to get a better sense of whether your nasal congestion might be related to rebound effect. Think about how your nose feels first thing in the morning before you use any spray. Is it completely blocked? Does it clear at all on its own? Now think about how quickly your congestion returns after using the spray. Is the window of relief getting shorter over time? Are you using the spray more frequently than you did 6 months ago? If you answered yes to these questions, it is worth having an honest conversation with your doctor about whether rebound congestion may be playing a role in your symptoms. Tell me in the comments right now, how long have you been using nasal spray? I genuinely want to know. And if you know someone who uses nasal spray every day, please share this video with them. You might be doing them the most important favor of their year. Let us now bring everything together into a clear action plan. Starting today, check the label of your nasal spray. If it contains oxymetazoline or xylometazoline, and you have been using it for more than 3 days consecutively, make an appointment to speak with your doctor about it. Be honest with your doctor about how long you have been using it and how frequently. Ask specifically whether you may have developed rebound congestion and what the best approach for your particular situation would be. Begin supporting your nasal health naturally with daily saline rinse, proper hydration, bedroom humidity management, and steam inhalation. Be patient with yourself. Recovery takes time, but it does happen. Your nose was designed to breathe freely and naturally without the help of a small bottle. The fact that it has been struggling does not mean it cannot recover. With the right support and the right guidance, it absolutely can. And the first step is simply understanding what has been happening, which you now do. You came to this video today because you wanted answers, and I hope what you have heard today has given you not just answers, but real hope and a real path forward. Your health after 60 is not about accepting limitations. It is about understanding your body well enough to give it what it actually needs. If you found this video helpful today, please subscribe to the channel and hit the notification bell so you never miss a health tip. See you in the next video. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health.